Hi Sarah, my name's Rebecca and I'm going to be your nurse today. I'm going to discuss ways to deal with some side effects and avoid some potential complications related to your diagnosis of acute myeloid leukemia. Here are some ways to reduce the risk of infection and bleeding. You want to use proper hand hygiene at all times. Avoid contact with anyone that's sick or has recently been sick. Avoid fresh flowers or plants. Maintain increased caloric and protein intake in your diet, and avoid aspirin. You want to be careful with brushing your teeth. You want to use a soft bristled toothbrush. Avoid flossing that could irritate the gums. Lubricate your lips and use an electric razor instead of just a normal blade razor. You're going to have a need for improved nutrition by increasing your calories and protein intake. Nutritional supplements would also be an option. Sometimes they're not always appealing at first, but they do offer different flavors that you could give a try. You want to use proper mouth care before and after meals, and anytime you're feeling nauseous, you can take something to help you make you feel better so you can eat without feeling nauseous or you're going to get sick. You want to try and eat small, frequent meals. If you try and eat too much at once, you might end up feeling sick. And you want to also avoid anything raw just because of the increased risk of infection. You want to avoid having a fever if all possible. You can use Tylenol to help reduce any fever you might have. Anytime you feel warm, you can take a sponge bath with cool water and change your bed and clothes frequently. You're probably going to notice increased fatigue. You're going to need to try and maintain some kind of physical activity when you can, physical therapy, or at minimum just doing just some passive range of motion for some activity. Hygiene is extremely important. You want to be able to do as much on your own that you can to preserve your mobility and function, and it'll just make you feel better about yourself to be able to do it on your own. How are you currently feeling about your anxiety?
A little worried, a little concerned about what my outcome will be, and a little depressed about the diagnosis.
And depression is a common side effect of any kind of diagnosis like this. If you're interested, we have referrals that we can make with at least a counselor to speak with about your diagnosis.
That might be good.
Do you have any spiritual or religious needs we can help you with at this time?
No,
Do you have any other questions?
not that I can think of right now.
Okay. Well, we're always here if you come up with anything you need addressed.